Welcome to the University of Buffalo's Student Health Services. You'll find us in Michael Hall on UB South Campus. This is your university doctor's office, where students can get treatment for all kinds of physical and emotional problems. Caring staff members are experts in family medicine, internal medicine, and women's health. You'll need an appointment, but they're usually scheduled the day you call or the next day. Care is available regardless of your insurance, and there are no co-payments for office visits. So please call if you need us. We're here for you.
Hi Melanie, I'm Teresa Betts, one of the nurse practitioners at the UB Student Health Center. I understand that you want to learn about birth control.
Yes, I'd like to start a birth control method, but I'm concerned about the safety and what to do.
Well, Melanie, it is very important to learn about birth control methods. Did you know that birth control has been around for thousands of years? Today, we have many effective as well as safe forms of birth control available to us.
Can you tell me about all the forms of birth control, and how do I know what's best for me?
That's a great question. Anyone who needs birth control wants to find the method that is best for them, and each of us has different needs when choosing a method. Learning about each method will help you make an informed decision. I will teach you about each method, and you can ask questions at any time. Also, when you meet with one of the health providers at the Student Health Center, bring a list of questions or concerns so that we can provide more information. Remember, only you can decide what is the best method for you, but we at the Student Health Center are always here to help you. Are you ready to learn about birth control methods?
Yes, I am.
Remember, feel free to ask questions at any time. Let's talk about the birth control pills first. Birth control pills, or the pill, is a kind of medication that women take daily to prevent pregnancy or to regulate their periods. Birth control pills are made of synthetic hormones. These hormones, estrogen and progesterone, are chemicals that are normally found in our bodies.
How does it work?
The pill stops ovulation, thickens cervical mucus, and thins the uterine lining, which all work together to prevent pregnancies. The pill is very effective, especially if you take it at the same time every day.
Are they safe?
Most women can use the pill safely, but like all medications, some have risks. So safety is a concern when choosing a birth control method. Make sure you talk with your Student Health Center provider about your health and whether the pill will be safe for you. There are benefits to taking the pill. It can reduce menstrual cramps, makes periods lighter, helps acne, and relieves symptoms of premenstrual syndrome.
Are there disadvantages?
Some women might have undesirable side effects, but often the side effects are few and go away after taking the pill for 3 months. Some of the most common side effects are bleeding between periods, breast tenderness, and nausea or vomiting. The nausea or vomiting may be stopped if you take the pill at night or with food. If the side effects become bothersome or last more than 3 months, please notify us at Student Health Center. There are some serious side effects, so please call us immediately if you have a new breast lump, a sudden very bad headache, pain in your leg, pain in your chest, trouble breathing, yellowing of your skin, or a missed period after having your period every month.
How do I get the pill?
If you decide on the pill, you will schedule a GYN appointment to get a prescription. At the appointment, I will discuss your medical history, check your blood pressure, and do a physical exam if needed. I will discuss the different pills, tell you when to start it, and when you will be safe to have sex.
How do I take the pill?
Most come in a pack of 28 pills, and it is very important to take the pill at the same time every day. This makes it more effective. If you brush your teeth or eat dinner at the same time every day, use those activities as a reminder to take your pill. If you forget your pill that day, take it as soon as you remember it. If you miss Monday's pill and it's Tuesday, take the 2 pills on Tuesday. But if you miss more than one day, call me at the Student Health Center and I will direct you on what to do. If you have a problem remembering to take the pill every day, there are other methods available.
What are the other methods?
The birth control patch is another method. DepoProvera is a small patch that sticks to your skin and, like the pill, has the same hormones, estrogen and progesterone. The hormones are continually released into your skin. The birth control patch is very effective, especially if it's always placed on the skin at the correct time. It is just as safe as the pill and has the same advantages, disadvantages, and side effects. It is easier to remember because you only have to do it once a week.
How would I get the patch?
You would schedule an appointment at Student Health Center to obtain the prescription for the patch. At the appointment, we would discuss your medical history, check your blood pressure, and give you a medical exam if you need it.
How do I use the patch?
It's very easy. You'll stick one new patch on the skin of your buttocks, stomach, upper outer arm, or torso once a week for 3 weeks in a row. You won't put on the patch for the 4th week. If you choose this method, I will explain how to put the patch on your skin.
Will people be able to see the patch?
Depending on the area of the body you place it and the clothing you wear, people may see the patch. But I will tell you about other options.
That would be great.
This is the Nuva ring. It's a small synthetic ring that is placed in your vagina once a month. It is left in place for 3 weeks and taken out the 4th week. So that's pretty easy. Like the other methods of birth control, Nuva ring releases the same hormones, estrogen and progesterone. So it has the same effectiveness, safety, benefits, disadvantages and advantages, and side effects as the pill and patch.
How do I put it in?
It is very easy to insert. You squeeze the ring and you put it in the vagina. If it feels uncomfortable, you just simply adjust it. If you decide on this method, just schedule an appointment like for the pill and the patch.
I'm not sure yet. Are there any more?
Yes, just a few more. The birth control shot is called DepoProvera. It is a progesterone-only shot which is given every 12 weeks. It's just as effective as the other methods and has some of the same benefits and side effects. Depo is different because during the first few months you may have some spotting and your period may eventually stop. This is normal. But if you experience other side effects, remember it might be a few weeks before they go away because the shot stays in your body for 12 weeks. When you are on DepoProvera, it is important to take calcium and vitamin D supplements. We also advise weight-bearing exercises like walking to reduce possible bone loss. It is very important to remember to get the DepoProvera shot every 12 weeks. If you are late for a shot, you will need to do a pregnancy test.
So I would schedule an appointment to get the shots at the Student Health Center?
That's right. You would schedule an appointment with me or one of the other providers to get a prescription for the DepoProvera. And then you would schedule another appointment to get the shot. Depo is given on day 3 to 5 of your period, so make sure that you schedule the nurse appointment at that time.
Are there any options that don't have hormones?
Sure. Well, the most common is the condom. If the condom is used correctly, it is very effective, and it will also reduce the risk of some of the sexually transmitted diseases like HIV and chlamydia. For women who cannot tolerate hormones, the condom is a very good option. There are condoms for the penis, and there are also female condoms that are inserted into the vagina. Always put the condom on before the penis touches your body. Use the condom only once and then throw it away. The Student Health Center has condoms available, and we can provide you information on how to put the condoms on correctly and some of the common mistakes people make. Sometimes a condom may break. If it does, emergency contraception is a good option. It can prevent pregnancy if started 3 days after unprotected intercourse. The sooner you start it, the better it will work. You can buy it at any pharmacy. Did you ever hear the diaphragm?
No, what is that?
It is a shallow latex cup that is inserted into the vagina to prevent pregnancy. The diaphragm prevents the sperm from joining the egg. In order to be as effective as possible, the diaphragm must be used with a spermicidal gel or cream. Before intercourse, you would apply the spermicide jelly to the rim and then insert it into the vagina, push it in and up. The diaphragm stays in place for 6 to 8 hours after having intercourse. Then you simply remove it, wash it in soap and water, and store it in a dry place. The last birth control option is the IUD.
I've heard about those on TV, but can I get one if I haven't had a baby yet?
Yes, you could have an IUD placed even if you have not had a baby. The IUD is a small T-shaped device that is inserted into the uterus to prevent pregnancy. There are 2 brands of IUD. The Paragard IUD is made of copper and is hormone-free. It's effective for about 10 years. The Mirena releases a small amount of progestin, a hormone, and is made of plastic. It is effective for about 5 years. If you choose an IUD, you would schedule an appointment to discuss the IUD with the doctor, and if you were a candidate for it, just schedule an appointment to have it inserted.
That's interesting. I've learned a lot.
I'm glad that you learned a lot. When you decide on the method that is right for you, or if you need any further information, please schedule an appointment with one of the GYN providers at the Student Health Center.
Thanks for all the information.
Well, thank you for coming in and have a great day.
Thanks, you too.